This is Pat interviewing Dave Weaver. Today's date is December 6th, 2016.
Hey, good morning.
Where and when did you receive your credentials, and where do you currently work?
Well, I'm a registered pharmacist in Colorado. I originally took my studies at the University of Kansas School of Pharmacy. I graduated in 1967, and I originally got my credentials, my first registration in Kansas, but I moved to Colorado, got registered in Colorado, went to work for a hospital here. Currently, though, I have my own business, Weaver and Company, and we're the manufacturer of the gels that are commonly used in EEGs and some in EKG studies too, but largely in EEGs of various modalities.
What drew you to EEG and diagnostics?
Well, I just wanted to start my own business. I was chief pharmacist at St. Anthony Hospital in Denver at the time. That was in 1978. And an opportunity came along to start with a little product, and being a single guy with nothing but my own ego, I guess, to satisfy, I wanted to be in business for myself, and I thought, well, I'll give it a try. A lot of people thought it was kind of foolish, but ended up making a little product called OmniPrep that actually took off pretty well and did very nicely and got me started.
Was this a popular specialty when you were starting your career?
Well, I knew people in the hospital who were EEG people. Fairly small department as departments go in hospitals. Pretty much, I think at the time, and I could be wrong here because I'm not an EEG technologist, never took any training in that field, but I did see that seemed the emphasis at the time was the, I guess what some might call a routine EEG or an EEG study that was done in something like 40 minutes or so. And that was seemed to be the extent at the time, but there was a growing interest in such things as evoked potentials, but a popular specialty. It was a specialty, part of the medical care that was all part of what we did back in the 70s.
Who were your early mentors?
Well, odd you should ask. I remember a guy, his name was Elmer Drake, and he was a guy that would go to breakfast. What I did at the time I started the business was I stayed at work at St. Anthony Hospital, but instead of being the chief pharmacist, I took the night shift, weekend only. I went in 11 o'clock on Friday and 11 o'clock on Saturday evening, and worked the night shift at our 24-hour pharmacy service. And then when I got off shift at 7 in the morning, I went down and had breakfast Sunday morning, and there was this old gentleman at the time. He was 85 years old or so, Elmer Drake, and he would sit down there and eat lunch or breakfast. Well, I sat down with him and asked him who he was because I routinely saw him after a few times. So it turned out he had built 39 gas stations in the Denver area. He started 5 dairies, and he was kind of an old codger that liked to talk to me about business, and he gave me a lot of great advice when I was really uncertain about what I was doing and why I was doing it. So top of my list probably is old Elmer Drake, who is, of course, long since passed away, but I still remember a lot of what he told me.
If you had not become a pharmacist, what would you like to have become?
Well, if I'd have been a better student at the time I was in pharmacy, understand that my first 2 years was at St. Olaf College, and I was a mediocre student. I passed, but C's and an occasional B were not leading the pack in terms of performance. So I thought, well, I need a more specialized career, so I went into pharmacy school at the University of Kansas. Today, with my academic record in high school and college, I probably couldn't even get into the school. But that's what I did. But had I not become a pharmacist as such. I had a strong interest in pharmacy and chemistry. I would love to have been just a research, I guess you'd call it a lab rat, somebody who hung around in a white coat and did lab work. I wasn't smart enough or studious enough, or wasn't ahead of the curve enough to really qualify as anybody who would, take advanced training. But if pharmacy, if I had my chosen career at the time, and I probably would have been stuck in a laboratory somewhere and really enjoying it.
Why do you think this field took off when it did?
Well, that's a good question. I think this is really, I'm really not the expert in this area, but I'm going to make a guess here that MRI diagnostics came in, really took a leap forward back at the end of the 70s and towards the 80s. And when it did, there was a lot of talk, well, this threatens some of the EEG diagnostic methods. But actually, I think somewhere along the line, EEG, a good part of it morphed into a sleep study, which was very helpful in a disease that was getting a lot of prominence, which was sleep apnea. And also then epilepsy became a big concern, and it was found that EEG monitoring, longer-term monitoring, became very instrumental in helping with the diagnostics of epilepsy. So we saw that occur, and the routine EEG, as we call it, or the standard EEG test, the 40-minute evaluation, I don't know if it decreased or just proportionally decreased by the growth of the industry itself, but neurodiagnostics certainly took off, probably against some of the predictions of some of the people in the field who thought that imaging was going to take the place of some of the diagnostics.
Did you use, and what were the main limitations of it?
Well, remember, I'm not an EEG technologist. I'm a manufacturer. That's what we do. We make gels that are used for EEGs and EKGs. And so I started making the product in a blender. This is the kind of blender you'd use in your kitchen. And then I found a fellow that had a very small manufacturing outfit, and I just rented space from him or time from him to mix and fill product. Finally, we bought our own manufacturing space and began to grow that way. And that was a good decision because, we started with some very simple mixing and filling equipment, and we've grown from that to much more sophisticated and automated equipment that fills tubes and jars, much bigger mixers called dispersers. We have two of them. One of them runs about a 350-gallon mix. We run a batch product twice a day in that one. So we've automated. We have 15 employees total, and we've had 15 employees for quite a while, even as we continue to grow. And a large part of that ability to grow is due to the fact that we've automated and continue to automate our process.
What memories do you have of your pharmacy training program?
Well, I go back to the University of Kansas quite a bit. I think I owe them quite a bit for my start. They gave me a chance to, a mediocre student, to focus on a profession that I really enjoy. So I know the dean and the assistant dean and the staff back there pretty well. I have great memories. We were a small class. It was a different time because back in the 60s, pharmacy was probably 90% male. If you look at the class, a lot of the class, my classmates were older. They had been out in business for a while, maybe worked in retail, worked in drugstore, and decided, what the heck, maybe I should go get a pharmacy degree and become a little more professional, maybe increase my salary, and so on and so forth. Now you go into the classroom and there's 120, 130 people in a class, probably 70%, I'm guessing, but 70, 80% are women, which is quite a change. And the science has really become very, it's a difficult course. When I was in the field, it was a 5-year study total from the time you started college. Now it's 6 years. So I have great memories, but things have certainly changed.
What are the main ways in which the field has changed over your career?
Well, I kind of described that, didn't I, when I talked about my memories of of school. But it has changed quite a bit. There's a lot more emphasis on the clinical aspect of pharmacy in the training. The things that we were fairly pioneering in when I was chief pharmacist at St. Anthony Hospital, things like involvement with cardiac resuscitation, being involved in some of the surgical procedures, and having a focus in the clinic was pretty new thinking, unit of use distribution of medications. Now today, pharmacists spend a lot of time in front of the computers looking at drug interactions at medical facilities. The medication is administrated by barcode recognition, and so things have changed dramatically in the field. And of course, the training has followed the trends in the field to prepare the people coming out of the university for much more clinical involvement. The University of Kansas School of Pharmacy and other schools are doing much more coordination with their actual hospitals.
What are the big issues in EEG that people are working on to solve today?
I know that one of the ones that we're working on is skin irritation, especially with the long-term diagnostics where electrodes are left on for several days, sleep studies, of course, overnight. The impact of that is to, be a irritation to the skin at times. People who are sensitive to materials on their skin show reactions, and this is a problem, of course, that's elevated because of the nature of the field, where the field has gone to long-term monitoring. When you leave a product on the skin for 40 minutes, probably it's not going to affect that patient's skin at that site, but when you leave it on for 2 and 3 and 4 days or longer, the possibility increases. So I think that's one of the big things that we would like to work on and like to solve. We've certainly worked with Asset and the Skin Safety Task Force team to build ideas that others have had in the clinic that they find through their experiences improved patient care in that area. But we're always looking for answers, always looking for results.
What are you most proud of in your professional life?
Well, that's a tough one. I work day to day, but I guess in looking back, we built a business. We're in 85 countries. We seem to be the leader in our field, one that we're proud of, but we're also humbled by, and we want to be sure we're doing the job right. So we've grown tremendously ourselves in our own knowledge of the field and our place in the field and how to manufacture in a proper and professional way. And we continue to look for ways that we can be more professional, more consistent, provide a safe product that's right. I've often told our group that the people that use our product can be anybody from president's family to their neighbors to their neighbors' kids. So we have to be careful. And so I'm proud of the group we have, and I'm proud of the business we've built, but it comes with some responsibility.
What's the best piece of advice that you've ever received?
Well, I have to go back to one of the old Elmer Drake. He was the old guy. I went down to breakfast one morning, and Elmer looked at me and he said, "What's the matter with you, boy?" Yeah. He says, "You look like you got a brown taste in your mouth." Excuse the comment, but that's exactly what he said. And I said, "Elmer, have you ever gone broke?" And he just laughed and said, "You ought to just go broke." He said, "Or do you a whole lot of good." And he said, "What's going on with you?" And I said, "Well, I'm not sure I know what I'm doing in manufacturing." And he said to me, he says, "How long have you worked in the hospital?" And I answered that question. He says, "Can't you walk around a hospital and pretty much, if I put a blindfold on you, you know how a hospital functions, how it works, who does what, where the people are, and what their role is? Don't you know that?" I said, "Oh, yeah, that part I know." And he said, "Well, how many of those smart marketing people do you think would love to have your knowledge?" And so what he was doing was he pointing out to me that I wasn't so ignorant after all, that there were things that I knew about hospitals, things that I knew from my own experience, that I could stand on my own. So I never forgot that. I thought, there are things that I can do that, and things that I know through my experience that will carry me forward fine. So at any rate, that's the long story.
Dave, thank you very much for your time today and this full interview.
Okay, I appreciate it.
Bye.
Okay, bye-bye, Patty.